Many people still don't realize that heart disease is the #1 killer of women. But with President Keith Miller putting awareness behind the American Heart Association's Go Red for Women campaign, this issue has become top of mind for our students at Virginia State University.
Do you know your numbers?
With some help from the American Heart Association and its Go Red for Women campaign, students are learning about a serious health threat and how to fight it. The American Heart Association is on a mission to raise awareness about the nation's biggest killer. One particular goal is making sure women know that if they think of heart attacks as a problem among men only, they may be ignoring a very real risk to their own lives.
We've thought of heart disease more of a men's disease, and yet women do have a break up until menopause, but after menopause, the rate of heart disease in women actually goes higher than that in men. So heart disease is really the #1 killer more than any other disease or any other cause.
Russell Warnick is the Chief Science Officer and co-founder of Health Diagnostic Laboratory Incorporated, a Richmond lab that works to test and inform patients about their specific heart disease risk.
Heart disease leaves traces in the body. We can take a blood sample and measure constituents in the blood like cholesterol, good cholesterol, bad cholesterol, that give an indication of a person's risk for heart disease. And then with those biomarkers, we know how to best treat.
Because these indicators are a reliable sign of not only the risk for heart disease, but also the steps that can prevent its progress. The American Heart Association's Go Red for Women movement aims to make sure that women have the information they need. Lisa Patton, Director of Development for Go Red for Women in Richmond, explains.
Our #1 priority and goal is to empower women with information about heart disease. Heart disease is the #1 killer of women. It kills 1 in 3, which is really a shocking statistic. And we have found through much research that these public awareness campaigns do make a difference with women, and they do change their behaviors.
With an increasing number of younger women falling into a high-risk category for heart health, the movement is spreading beyond senior centers and onto college campuses. At Virginia State University, its presence is welcomed by the university president himself.
Dr. Keith Miller believes so passionately in our message and knows that we have a great message that we can share with the women on the campus. Are you taking care of your heart health? By partnering with VSU, we have an opportunity to go on site and do some health fairs, conduct some health fairs where we can provide information to the women on the campus and really try to change behaviors.
Hello.
Marilyn West, a Richmond business owner and the 2012 chair of Go Red for Women, says that Virginia State's participation in the program was especially notable.
We're so delighted that the university has stepped up to work with us. In fact, Virginia State University was the first university that pledged its support for the Go Red for Women initiative, and we're just absolutely delighted.
The partnership was of particular interest to the Alpha Kappa Alpha sorority. Dr. Linda Gilliam, Mid-Atlantic Regional Director for the sorority and an alumna of the university, tells us why.
Ladies, want to make a promise?
It's critical for us as women, particularly African American women, to take care of our heart, to take care of ourselves, because heart disease impacts the African American community more than any other. So it is very important for Alpha Kappa Alpha Sorority Incorporated and the women in the organization to take care of themselves so they can impact the communities in which they live by being the models for the women that we work with.
And that's the one I need to continue to work on.
Angela Wilkes is the Director of Diversity and Small Business Liaison Officer at Owens & Minor, a healthcare supply company, and one of the many supporters of the Go Red for Women campaign. She says that it brought about a major change in her life.
The Go Red for Women campaign helped me by saving my life. It created an awareness of the numbers of where I was in terms of high cholesterol, hypertension, all of these things that were on the inside of me, but I had not examined or looked at.
Wilkes says that by exercising, changing her diet, and finding ways to relax despite a high-stress job, she has lost 84 pounds and significantly reduced her risk of an early death. She is committed to making this change a lasting one.
Well, it's important to me, it's important to my family, and it's important to my community because I am very involved in the community, and I want to make a difference there as well.
At the hospital, he's going to need to have a venous duplex ultrasound.
Dr. Christine Browning, a Richmond cardiologist, is a medical spokesperson for Go Red for Women. She says that learning your risk and a strategy to reduce it is as simple as a checkup with your doctor.
You can also go to the American Heart Association's website and take the My Life Check, found at www.mylifecheck.org. This will focus on finding your own personal risk for heart disease and gives you steps that you can incorporate it into your life every day to lower your risk.
Dr. Browning says that a few simple changes can brighten the outlook for each woman who heeds this advice, and for the entire next generation.
By following a healthy lifestyle, and that means quitting smoking today, exercising regularly, and eating healthily, we can all make big changes in the risk for heart disease 15 or 20 years down the road. But those changes have to be made today to reap the benefits tomorrow.
And while it's never too late to get started, Angela Wilkes has a message for students and other young people who may be putting off a healthy lifestyle change.
The message I have for young people is to get started now. You have your entire life ahead of you, and it is a wonderful life. Being healthy makes all the difference in the world. It is such a wonderful opportunity for women, for young women of color, and just to feel good, to perform at your highest intellectually, and to just be the best that you can be.